So patient care is of the utmost importance to us. We like to see the patient back a week after the transplant, at 6 months after the transplant, and 12 months after the transplant.
Patients would expect the grafts to begin to grow at 3 or 4 months, would grow out to a short length as such at 6 months and grow out to full length at 12 months. So I suppose this is important in judging before procedure, for instance, whether or not they'd be able to attend a wedding or whatever social gathering that they were aiming for after the procedure. You'd have to gauge it according to the time that you'd left yourself to recover after your surgery.
We usually recommend sleeping for the week afterwards. If you sleep with a travel pillow around your neck, this is purely for comfort in the donor area, because the donor area might be a little bit sore or tender, and if you're putting your full pressure on it when sleeping, it's going to get sore. So if you're sleeping with a travel pillow, you won't put necessarily full pressure on your head, so that alleviates that pain. Ibuprofen can be used for pain relief for the few days afterwards. If you keep yourself topped up with ibuprofen, you shouldn't feel any pain at all. We encourage all our patients to pick up the phone, send us a text or an email if they have any queries or questions. There's always someone at the end of a computer or at the end of the phone that would be able to answer the questions, whether it be one of the technicians or the surgeon or one of the care people working here. There'll always be someone at the end of the line to be able to answer your question and put you at ease.
I would argue that perhaps patients shouldn't actually buzz the donor area after surgery, maybe less than a 3 or 4 blade, basically to avoid detection of the actual grafts harvested. When you remove a graft in FUE, you're also removing a cuff of skin with that particular graft, which would contain melanin, the skin pigment, which is responsible for skin colour. So if you're actually buzzing your hair down, very tight, you're going to expose that skin to the sun, therefore usually causing the melanin to actually colour the skin as such. But if you're only buzzing that hair down to a 3 or 4 blade, that shouldn't happen. A
month after transplant, the transplanted hair does fall out. This is supposed to happen. The root is still there. The hair that falls out is just making way for the new hair to grow up. So you will start to see the new hair coming through 3 to 4 months after transplant, and it will gradually grow then over the next 8 months until it comes to 12 months, where you should see full growth of the transplanted hair. A good idea, if you're worried about shaving your head for the transplant, we suggest shaving your head maybe 4 weeks before the transplant, 2 weeks before the transplant, just so that you get used to that look and everybody around you gets used to that look. And then it's not such a shock once you actually have the transplant to see you with the shaved head. Most patients actually say to us that once they shave their head, they feel that actually they think, what was I worried about? It's not actually as bad as I thought. It looks okay and it looks good.